indicates that most people do not find the need to add self care to their to do list as workloads and other daily activities get in their way. This has, however, increased cortisol levels, known as Cushing syndrome, in most people, leading to critical health conditions. There is more in the following report.
Cortisol, the primary stress hormone that increases glucose in the bloodstream, enhances the brain's use of glucose and increases the availability of substances in the body that repair tissues. It slows functions that would be non-essential or harmful to the body. It changes immune system responses and suppresses the digestive system, the productive system, and the growth processes. These complex natural alarm system communicates with the brain regions that controls mood, motivation, and fear. The cortisol level must stay normal than higher, as high cortisol level exposes one to danger. The body stress response system that strums the body to fight or flee danger, known as the fight or flight mood, is usually self-limiting. After a stressful day, once a perceived threat has passed, hormones known as the adrenaline and cortisol return to typical levels. As these hormones drop, your heart rate and blood pressure return to normal levels, and other systems go back to their regular activities. But when stressors are always present or active, the fight or flight reaction state turned on, and the long-term activation of this mood and other stress hormones can disrupt all the body's processes. This puts you at higher risk of many non-physical health problems, including anxiety, depression, digestive problems, headaches, muscle tension and pain, heart disease, heart attack, high blood pressure and stroke, sleep problems, weight gain, problems with memory and focus, and it is likely to affect people who are 20 years to 50 years old. Symptoms may include upper body obesity, a round face, and a thin skin bruises. It is said that taking large amounts of corticosteroid medication also stresses the cortisol. Dr. Mohammed Maftal, doctor at the Sredro Government Hospital, highlights more ways to treat and cope with the condition.
Talk about cortisol. Basically, it's a stress hormone. And whenever your body is subjected to a lot of stress due to work, family, sickness, this hormone can go high. When the hormone goes high, it is there to help you, your body, to be able to fight the circumstances you are there. So too much of it will cause you a lot of damage. There's too much stress on the body that is causing the rise. So that's the first thing. So all those things, some aspects of them, you use some kind of medications for them. And there are others too that, for instance, if it's due to chronic stress, then there will be a lot of counseling, some lifestyle changes so that it will be able to reduce the stress level. And in some cases, even surgical intervention will be required. For instance, if there is a tumor in the brain, it can give a wrong signal for cortisol to be produced. Or sometimes if the adrenal gland is even enlarged, it can even cause more of the cortisol to be released. So in those cases, surgical intervention is normally required. Normally, there is a hormone replacement therapy that you are normally given with the cortisol that can be able to replace the indigenous one. So that's basically what normally required. But most importantly, stress management is very, very, very important. And there are certain forms of stress that is also as a result of sickness. So when you have that, you have to try and then seek appropriate care so that sickness will not put so much stress on your body. As I mentioned, one of the diseases we call Cushing's syndrome. Yeah, Cushing syndrome can lead to symptoms like weight gain, like you'll be there, you are not eating, you lost appetite, but you are growing fat. And most often, this kind of weight gain is around your abdomen and then your face. So sometimes when you are there, people are growing fat around their abdomen and their face. We think it's a sign of good living, which is not. And then also one other issue is it can also lead to high blood pressure due to when the chronic stress causes high cortisol. High blood pressure is one of the complications. And then also we have also type 2 diabetes, and then we also have cardiovascular conditions, other heart abnormalities, abnormal function. Then I also mentioned the cognitive impairment, referring to how the brain is able to remain attentive. So that brings us to even eating balanced diet. You see, when you tell people to eat balanced, that sometimes they tell you the economy is too much. But you see, somebody can go and buy plenty meat with fufu without taking into consideration even, for instance, fruits or vegetables. So these are certain things that if you manage ourselves, whenever you are eating, if you can maybe save like 1 cedi or 2 cedi to even buy one orange or pour, you can be able to protect yourself and then live a healthy life.